I'm Xana Beams, and I'm actually the Director of Advocacy for Doctors for America. And I came out here because Don is holding an anniversary celebration for the organization. So our organization is a nonpartisan group of physicians who are working to make a better healthcare system, a more accessible, higher quality, more affordable system for all Americans, mostly through progressive healthcare policies.
So it's a nationwide organization of doctors that are passionate about getting healthcare reform and passionate about advocacy for their patients. I think that's really the big thing. And in terms of what it does for people here in Dayton, it's kind of a nidus for forming or for getting together and for making these talks and these kind of things come together, and I think that's what it's really been.
All of us, though, I think started by just sharing information and helping to create that critical mass of people thinking that perhaps everybody needs good health, and that it might even be a right, but we also know that it's important that we maintain medicine as close to that it is in terms of being able to provide the high end of research and positive intervention. So we don't want to destroy medicine as we know it, but we do want to make sure that everyone has access to good health. And that was really the motivator that got me involved.
My name is Don Nguyen, and I'm the State Director for Ohio State for Doctors for America. Way back a year ago, we started with a meeting in the little room down the hallway here, and we sat down and we said, how can we do, how can we make an impact in our community in terms of passing healthcare reform? And so we started.
Anybody who's practicing medicine these days knows it's not what it used to be in many different ways. So patients aren't getting the care they used to get. Physicians are not able to practice as freely and with as much integrity as they used to.
Every day that I go to work, I see the tragedy of our patients not having the appropriate care, access to care, and almost begging and pleading for the system to be fixed in some way, shape, or form for themselves and for their relatives and for their friends and their community.
I think it is a moral imperative. I think that, you know, as a nation, we've gone to a lot of trouble to protect really nebulous rights like freedom of speech, freedom of assembly, you know, all these things that absolutely are human rights, no question. But we haven't drilled down and really understood as a nation that if you can't breathe comfortably, you can't speak freely. If you can't walk without pain, you can't assemble freely. And so really getting that as a nation, absolutely, I think is a moral imperative, and who better to bring that message and point it out to people than the people who are taking care of people, the physicians, nurses, other healthcare providers.
Well, essentially, you're a patient's advocate. So if you're not involved and you don't know what's going on at a national scene, you can't bring it back to them and tell them, this is something I feel passionate about. I'm taking the best care of you, not only healthcare-wise, but also in terms of a legislative perspective.
A whole bunch of people have asked me if I thought we made a difference. I think the difference that we made wasn't necessarily that the legislation wouldn't have passed without our signatures, but it was that this time around we controlled the narrative around healthcare reform. We didn't let the stalwarts who are mostly interested in increasing their incomes, or the stalwarts who are interested in taking down the Democratic Party no matter what it does to their neighbors, control the narrative. We didn't let them tell the story. We told the stories. Physicians like Dr. Leroy and Dr. Nguyen and Dr. Bosley in Nebraska and all around the country told the story of how their patients are suffering in a broken system and it has to change, and we're going to make it change now. And that made the difference this year.
I think there absolutely is more work to be done.
There's
I mean, as far as
yeah,
I think the healthcare bill in its current state is an excellent start. I think we still have a long way to go, and as things unfold with the current bill and as it goes into effect, we'll find out where the kinks are, where things can be improved even more, and still continue to push legislation towards the best interest of our patients.
We're happy that we got a bill passed, absolutely. And remember that there are 16,000 people, physician members of Doctors for America, over 16,000. So I can't speak for all of us, but certainly I would say that as an organization and as the leadership of the organization would have certainly liked to see more. We would have liked to see the bill the law go a little bit further, but we're happy that it's a first step. We're happy that as a nation we now have a mandate to start to make a better healthcare system, and that as a nation we've at least admitted that there's a problem that we can now work on together at the state level.